Hi, I'm Graham Garber. I'm a general dentist. I'm the owner of Friends and Family Dental in Providence, Rhode Island. And my expert tip is removing pain from basic dental restorative procedures. So the problem we all have in dentistry is that patients really associate pain with going to the dentist. And so for millions of patients, they avoid going in for routine basic dental restorative needs. For roughly half of patients, they report feeling some type of dental pain while at the dentist. And for about a quarter of patients, they report post-operative pain. And that's a real problem and a compounding problem because patients are avoiding their basic dental procedures and they're really just waiting for pain to dictate when they go to the dentist. So to really overcome that problem, you have to uncouple pain from the dental experience. And so my approach has been to seat a patient in the chair, make them as comfortable as possible, give them a pillow, a blanket, whatever it takes to make the patient feel comfortable in the dental chair. Secondly, explain the basic restorative procedure that I'm going to be doing and answer all their questions. Really just try to put the patient at ease. And lastly, take pain out of that whole experience. So initially I tried using copious amounts of topical benzocaine, but that has its limitations. You still have to apply a needle and patients still report some type of pain. So I then looked at options for doing needle-free dentistry where you're just trying to block pain transmission in the oral cavity. So I was initially looking at incorporating a CO2 laser into my practice. The problem with that is that the units are very, very bulky and they're very, very expensive. So last year, I incorporated the dental pain eraser into my practice, and that relies on proven medical technology to block pain transmission in the oral cavity. And that really has been a game changer because now I can do basic restorative procedures, I can do crown preps, I can do tooth restorations, I can do implant restorations, even some endodontic therapy, and do that in really a painless environment. And for patients, that makes a huge difference because I've got a lot of patients with high anxiety that I can now treat with these basic restorative procedures that I'd otherwise have to refer out, or they would just avoid coming to see me altogether. Additionally, for patients with really busy schedules, it allows them to keep those appointments because they know they can return to work immediately after their appointment without any post-operative symptoms or post-operative pain. And so really by removing pain from these basic dental procedures, it allows me to decrease patient anxiety and increase treatment acceptance. So thanks for listening to my tip.